Hello, Alan and Drew here for a special event. We are here to celebrate the grand opening of our practice becoming Physical Therapy and Balance Centers, formerly the Howell Rehab Center. You are familiar with our care, and now we have some exciting new treatments to highlight along with some that you might know well.
Alan opened the Howell Rehab Center nearly 22 years ago. He has always strived to provide the best patient care over the years by focusing on the best practices, using new modalities and treatments for each and every patient that he has had the privilege to treat. These traits have provided us an opportunity to expand our ability to serve the community, so we decided to partner with Physical. Physical Therapy and Balance Centers is a national physical therapy organization that focuses on improving quality of life by using a holistic, whole-body approach to connect a diagnosis with a customized treatment plan. By adding new treatments to our existing services, we will be able to further help you love your life.
Drew, as you know, it has been a passion of mine to provide my dedication and commitment to everyone that has walked through our doors. To watch you, Drew, and Natalie provide the same level of care with me is a great pride, and I am very excited that we are in a place where we can join Physical. With this special staff in place, it was a perfect time to partner with Physical Therapy and Balance Centers to provide services like balance training, Shockwave, the Biodex, and dry needling to the greater tri-state area.
Exciting times, Alan. During this grand opening, we're going to take you through a number of our services at our Pleasant Ridge and Delhi locations. So sit back, get comfortable, and let's get started.
Here at Physical Therapy and Balance Centers, we are trained to treat vestibular and balance disorders. Whether you're suffering from vertigo, other vestibular disorders, or general balance deficits, we will assess and treat you accordingly. We are able to assess and examine a patient with vertigo and correct any abnormality that we may find. Once a patient is symptom-free, we will begin balance testing and training due to oftentimes having residual balance deficits. In order to customize your balance plan, we will complete balance tests on the Biodex machine. The purpose of this machine is to test and train patients, and the great benefit of this machine is that it gives objective data to be able to start you on a balance program that is specific to your deficits, as well as allows us to compare your scores to normative data of other individuals of similar age and with similar conditions. Here, we are performing a modified CAT-SIB test. This stands for Clinical Test of Sensory Integration and Balance. As you can see, the Biodex allows us to see the amount of sway the patient has during the various balance tasks and gives us a sway index score following each attempt. Once the test is complete, we will give a composite sway index. It will also provide us with a printout for us and the patient to review together. Once we finish the test, we will begin training. We will perform the training here on the Biodex for static balance training and lower level dynamic tasks. Here we have our overhead rail system with attached harness. This is a great feature to use when patients have progressed to more dynamic and higher level balance tasks. The harness allows the patient to complete these higher level balance tasks in a safe environment for both the patient and the therapist. This harness and rail system is also great for gait training safely and gives patients confidence to improve their walking.
Welcome to our Delhi clinic on the west side. We're going to go over a few things that make us unique and different than other clinics. At the Delhi clinic, we use a HydroWorks Evo pool. With this pool, you enter into one chamber, the water then transfers, we move you into the treatment chamber, and then the water raises to whatever level we want. There's actually a treadmill in the bottom of it, which is a really cool aspect. We also have a massage hose and a seat in it for other exercises. The benefits of the HydroWorks line of products and aquatic therapy include walking in a limited weight-bearing environment, running with less impact, core stabilization, especially after back surgery and back fusion, early weight-bearing after surgeries and fractures, doing cardiovascular exercises in a pain-free environment, and finally, sports performance and acceleration training. Aquatic therapy is covered under most insurances, and we offer single and multiple session packages as well.
Thank you for being with us. Next, we are going to talk about some modalities that set us apart from other physical therapy clinics. These new devices help with the reduction of pain, tissue tension, and improve flexibility to promote healing. One new treatment that we are really excited about, the radial pressure wave. We are one of the few PT clinics that offer this awesome new device, also known as Shockwave. The Shockwave restarts the healing process by focusing the energy waves to the injured area. Patients with chronic conditions such as tennis elbow, Achilles tendinosis, and patellar tendinosis can feel a significant change in their pain as little as 3 treatments. However, patients that have chronic plantar fasciitis can really benefit the most. Reintroducing blood flow to this area can cause immediate healing with reduction or elimination of pain within just 6 treatments. The radial pressure wave is helping patients find relief for those chronic ailments where other traditional treatments have failed.
Here at Physical, we offer a service called trigger point dry needling. This modality is used to get rid of tight spots, pressure points, and eliminate myofascial pain. Common areas that we treat with trigger point dry needling include postural muscles, especially in the neck and low back. With these muscles, we develop trigger points and tight spots due to poor prolonged posture, especially when we're working on a computer or staring at our cell phone. Other muscles that we treat are in the extremities. These include muscles of the arm, in maybe bicep, tricep, down into the forearm, and other conditions such as tennis elbow. We also move into the legs, and we start with muscles in the glute region, moving down to the quadriceps and hamstrings, and down into the calves. We also get to the feet with the lower extremities and treat other conditions such as plantar fasciitis.
Another service that we provide here at Physical is metabolic testing. Now there's a number of reasons why you would want to get a metabolic test, but we're going to focus on a couple of those. The first is the resting metabolic rate, or the RMR. Now this is going to be the easiest test that you will ever be able to pass. You sit in a comfortable chair for 10 minutes, outfitted with the breathing mask, breathing for 10 minutes. At that point, we are provided information of how many calories you burn at rest in a given day. Whether you are looking to lose weight, gain weight, or maintain weight, we are going to be able to coach you based on that resting metabolic rate number of how many calories you should consume in a given day. For the endurance athletes out there, whether you are a cyclist, a swimmer, a triathlete, or a runner, what we can do by putting you through a metabolic test is find realistic zones for your heart rate and how you burn calories in those zones. From there, we will then be able to assist you in your training to maximize your benefit and your development, therefore making you or giving you the opportunity to be the best athlete you can be.
Hello there. My name is Chris Howell, and I would like to introduce you to our Pilates reformer here at Physical. The Pilates method is a workout that systematically addresses the entire body. It is meant to increase flexibility, core strength, and stability, to improve body alignment and circulation while developing perfect body awareness, overall strength, and in many cases actually prevents injuries. We have a number of patients complete their physical therapy rehab and move to Pilates due to the benefits the practice provides. At Physical, our trained instructors practice the same method as Joseph Pilates with some enhancements from our current knowledge of biomechanics. Our experience and understanding of the human anatomy provides us a deep exercise library to help our patients, especially when they might have limitations or previous injuries. This is Dr. Min He. When Ming came to us for Pilates, she was doing yoga on a daily basis, but what we noted was that her strength was not where it should be, nor was her cardiovascular exercise where it should be. Now we have been able to bring Ming to a different spot where she's much stronger and healthier and can enjoy her family much more.
Drew, there's some exciting things going on physical therapy and balance centers.
Indeed, Alan, I'm excited to be a part of the team. We would love to hear from you. Please give us a call and we'll arrange a time for you to experience the future of physical therapy in our safe, socially distanced clinics. We look forward to seeing you soon.